I'm honored to be here for many reasons. First, to return home to Harvard Medical School, which has been my home for 40 years and will always be my home, and to acknowledge the great work of my dear, dear friend Joan Reed, who makes so many contributions. Second, I want to acknowledge the wisdom and vision of the Commonwealth Fund to establish this fellowship nearly 20 years ago. It was relevant then, and it's even more relevant now. Third, to honor the late Jim Mongan, for whom the fellowship is named. Jim and I worked very closely together in my years at Partners, and I admired him for many, many qualities, but foremost was his deep, deep commitment to the principles of this fellowship. So it's so appropriate that it's named for him. Finally, I'm honored to be here to meet this sparkling group of fellows, all of whom I've met, to congratulate you on this milestone in your careers. I've reviewed your resumes, and I've actually read something about your projects. You represent a wonderfully diverse backgrounds and practice settings and are at different stages in your own careers. You have a wide spectrum of important projects, including infant mortality, human trafficking, emergency room utilization, measuring disparities, using community health workers, and oral health in community health centers. In the face of all this differentness, what you share is clear as a deep and abiding commitment to social justice, and that augurs well for your future and for the future of medicine. Joan has asked me to reflect on some trends I see in medicine today, and I will do that briefly, along with some comments on the educational implication of those trends, and on some personal notes about careers and inclusion. In my own career in medicine, and it's now, believe it or not, 50 years since I entered medical school, I have witnessed and benefited from the transformation of medicine from a cottage industry into a big science, big technology, big business industry. During that time, our capacity to cure and mitigate disease rose exponentially because of scientific discoveries to better understand disease and because of new and effective diagnostic and therapeutic interventions. To give a few examples, mortality for cardiovascular diseases steadily declined in the last 50 years. More effective and less toxic cancer therapies are now available, prolonging lives. Organ transplantation can result in long and productive survival. And a new disease, AIDS, was transformed from a uniformly fatal disease to a chronic disease in one generation. All of this has occurred during my time in medicine. But alongside these triumphs, there have emerged legitimate concerns. Do bigness, science, and technology dehumanize medicine? Do business and commercialization threaten professionalism? Are the benefits of this progress available for all? Why are there such great variations in both processes and outcomes of care? And can we afford all of this? All of these questions and the responses they evoke have created a very unsettled moment in healthcare. Healthcare is embarking, I believe, on yet another transformation. This transformation is not a rejection of the science and medical technology. It should not be a rejection that fueled the last transformation. These forces can and must continue, but how they are harnessed and how we reconfigure our healthcare delivery system for greatest societal benefit will be strongly influenced by three new powerful and emerging forces. And these are consumerism, the information revolution, and a return of interest in social justice. Consumerism. Patients, or more appropriately, the public, will increasingly demand and have access to all of their health information. They will become true partners, not only in their own health decisions, but in determining how the healthcare system is redesigned. They will be the drivers of truly personalized medicine. Open notes, CVS clinics, medical apps are but early manifestations of this powerful force that is going to grow. The information revolution, and by that I mean the ubiquitous access of information for all, and big data, which is the aggregation of all that information, will support this consumerism, but it will also change, and is already changing, how we learn, how we communicate, how we assess, and how we improve. Properly harnessed, it can help us more closely link our education and our healthcare delivery so that education is informed by patient demographics and outcomes. Assessment of educational performance in real time can lead to the individualization of education and improve efficiency in our educational processes. The assessment of clinical performance in real time will drive improvement and will help to drive out unwarranted variation. But answering the questions raised by the turmoil of our present state of our system and successfully dealing with the old forces of science, technology, and business and the new forces of consumerism and information revolution will require a re-examination of our social contract through the lens of social justice, which is the third powerful force which must reemerge. How can we achieve the most equitable, reliable, and efficient system that serves everyone's needs and supports the health of the public? Now, to do all this will require a different set of skills for the physicians of the future. With information readily available for all, physicians will not be differentiated by who knows the most. They will be differentiated by other important skills that have been insufficiently emphasized in our selection and our educational processes up to now. These skills include critical thinking and analytical skills, to be able to ask the right question, to turn all this information into knowledge and to turn that knowledge into wisdom. It includes teamwork skills, to both lead and follow, to take part in successful collaborative teams that makes full use of the skills of all health professionals. We must have such teams to provide the best and most efficient care to our patient population, which is older, more chronic disease, and more complex disease. It includes communication skills to elicit patient preferences with empathy and cultural sensitivity, and to work effectively with all colleagues in our increasingly complex systems. It includes skills in community relations that derive from an understanding of our social contract and enable us to truly partner with patients, families, and communities we serve to make our systems of both education and healthcare more equitable, accessible, and reliable. And finally, it includes skills in change management that enables us to manage change both internally and externally, and truly fulfill our professional responsibility to continuously learn and adapt. Now, flexibility and change have not been qualities that physicians have heretofore been known for, selected for, or rewarded for. But that must change, because when you are giving this talk 30 or 40 years from now to those that follow you, the medical world will be dramatically different in ways that we cannot even be imagined now. We need to prepare people to continue to change, continuously change. Now, this list of skills must drive our educational agenda, and that's what we're attempting to do at the Macy Foundation. This is what we need to prepare people for, to be the successful physicians and leaders of tomorrow. But I do believe that the period that we are entering is just as exciting from a career standpoint as the one that I entered nearly 50 years ago. Careers in medicine remain fulfilling because they continue to offer the unique opportunity to combine humanism and science in a way that's unmatched by any other profession. Medicine also affords great flexibility, as we can each play many roles throughout our careers. You heard a little bit in my own career. I've been a practicing cardiologist, an internal medicine program director, an ICU director, a founder of a patient outcome research unit, a chief of medicine, a director of Academy of Medical Educators, a chief medical officer at a hospital and a system, and now a foundation president. Now, this could be evidence that I can't hold a job, some would say. But I would rather take it as evidence that we all have a chance to reinvent ourselves. And in that reinvention, we find continuous learning and renewal. So I urge you, you will have these opportunities. Seize them. Take advantage of them, even if it's a little anxiety-provoking. I want to conclude with some comments about diversity and inclusion. Now, I know I don't need to tell this particular audience of why that's important, but I think we need to reflect on why it's important so we can redouble our efforts. It's important for many reasons that we have more underrepresented minorities in medicine, in all the health professions, and particularly important that we have them in academic and leadership roles. It is, first of all, an issue of social justice, to have equal career opportunities. We were reminded of the importance of social justice when we had the 50th anniversary of the March from Selma, right, about the importance of voting rights. Social justice is more than that. It's important, of course, we know, as a means of improving access and quality of care for all of our citizens. And we have good evidence of that we need a diverse workforce to do that. We also know that it's important if we're going to enhance the educational and professional opportunities and satisfaction of everybody. People learn better and practice better when they're in a more diverse environment. And furthermore, it's imperative we will never meet all of our needs if we don't draw on all of the talents of all of us, the citizens of our nations. But finally, and probably most importantly, increasing diversity and creating an environment of inclusion is necessary in order that all of our institutions, our educational institutions and our healthcare delivery institutions, realize their full potential and be as good as they can be. It is, in fact, about institutional excellence. It is the reason we must redouble our efforts to be sure that our health professional workforce is truly inclusive and reflects the population we serve, so that all of our institutions will, in fact, be as good as they can be and will function as the highest level. We will not successfully get through this next transformation and get us to the state we want to be in unless we do that. So I thank you for the privilege of interrupting your wonderful reunion that you're having and your wonderful celebration that you're having to speak to you on this very important occasion for both the graduating fellows and the returning alumni. And I can feel the pride and excitement that everybody feels. And because of people like you, I am very optimistic about the future of medicine. So good luck and Godspeed on your journey.
Any questions or comments for Dr. Thibault?
You spoke about the reemergence of social justice. I wonder if you could just comment on the reemergence concept.
Well, I guess I'm being generous in saying that because I'd like to believe it's always been there to some extent. It's certainly been a driving principle for individuals. But I don't think we've expressed it enough as a society. So by reemerging, I mean the coalescence of individual belief in it to make it more of a driving force of how we will create a system. And I think without that, we are not going to succeed because the tough decisions ahead do involve making them in terms of a social justice lens of what is best for the most and what is best for the health of the public. And I think that is becoming more a part of the conversation. And some would say, and I would agree, it's not enough a part of the conversation. The people in this room, I hope, are going to drive that conversation so that it is, in fact, an important part of the conversation, because I don't think we'll undergo this next transformation successfully without that framework.
So I have a question for you. It's a little bit awkward sort of question because I've seen your roles and I've seen what you've done here. I've seen what you've done as you move forward in your career at Macy and the ways in which Macy's actually supported the work of our office. But you've spoken about the potential of people in this room to contribute to this social justice and moving it forward. But many of the people in the room that help open the doors for them. And if you could speak just a little bit about this concept of how we pass on and help.
Yeah. No, that's an important issue. So everybody, none of us has gotten here alone. I didn't get here alone. I had lots of help along the way, not only from my wonderful wife, my lifelong friend and partner, but from mentors, from people that opened doors for me. And each of you, it will be already is in a position and will increasingly be in a position to do that for others who follow. And that is such an important role, and it's one of the most gratifying roles to play in one's profession, and that is to help other people along, to be generative. And that speaks to the diversity issue, but it's not just a diversity issue. It's supporting and helping the careers of all that follow us in ways that will help them find the greatest fulfillment, and that's going to be different for different people. So one of the things that has been most fulfilling in my career in these various jobs that I've had, I've regarded them all, they've had different titles, but I've actually thought of myself in every one of those roles as a teacher, as an educator, regardless of the title I had. All of those jobs are teaching jobs, and every job that all of us have are potentially teaching jobs. We're teaching our patients, of course, and our patients are teaching us. That's a bilaterality to that. And whether we're directly involved in something that's called teaching education, or whether we're involved in helping to improve care in a system, whether we're involved in helping to create a more effective team of people, whether we're involved in being on the receiving end of learning from a nurse who knows more than we know about how to take care of a given patient, all of those are teaching and learning opportunities. And the excitement I've had since I went to the Macy Foundation is the chance to try to influence how we think about teaching and learning on a national scale, and particularly how we think about it in an interprofessional way. I think that's, from an educational standpoint, that may be the most important paradigm shift we need to bring about. That when you think about it, all of us will spend our lives working in teams, regardless of what we're doing. Direct patient care, administration, research, it's all team-based activity, but increasingly the clinical part of our activities are team-based. And we have not been preparing people for that by either exposing people to the opportunities to learn from one another, from, about, and with other health professions, nor have we made it clear that being competent in teamwork is one of the important credentials for moving forward. We don't hold that up, we don't teach it, we don't measure it, we don't reward people for it. So all of us are in a position to help influence that and change that, both by examples that we set, by taking advantage of every encounter, every opportunity to make every moment into a teaching moment, and then to open the doors for those that follow us. And it is, in fact, a tremendously fulfilling part of all of our lives, and every person in this room has a chance to do that.
Thank you. Thank you.
Thanks.
So part of what I want to say, and I think one of the real strengths of our fellowship is as we started out in the Commonwealth Fund, Karen Davis were so wise in terms of understanding the importance of diversity in terms of our workforce, in terms of leadership and health reform and changing health systems, and has been so supportive for so long. But I think the addition of dentists to our fellowship has made a huge difference in this understanding that it's one body. It's not like the mouth is over there and the rest of me is over here, but it's all connected. And that when we're talking about leaders and individuals who can move into positions to change our systems across the board, they can be physicians, they can be dentists, they can be nurses, they can come from multiple disciplines. And so I also want to publicly just say again, thank you to Delta for creating a space where dentists could be trained with physicians for leadership. And I think my proudest day in the fellowship was we were at NIH with a group of fellows, and it might have been one person in this room, and one of the institute directors finished with a presentation, and it was a physician who said, "You haven't spoken about oral health yet." Thank you for being here. Thank you for a wonderful evening. Thank you to all of our guests. As you can see, we're a big happy family. And once you're here, you're part of our happy family. So when you're walking down the street tomorrow and somebody hugs you, just accept it. Just accept it. I want to end with a quote. It's from one of my favorite poems, and it's a Psalm of Life. And it says, "Lives of great men and women all remind us that we can make our lives sublime, and departing, leave behind us footprints in the sands of time. Footprints that perhaps another sailing o'er life's solemn main, forlorn and shipwrecked brother, seeing shall take heart again. So let us then be up and doing with a heart for any fate, still achieving, still pursuing, learn to labor and to wait. You are the individuals who are going to carry us forward, and I'm proud to be associated with you. Thank you."